Welcome, sir, to the Voice of Healthcare, third edition of National Diagnostics Forum and Award. Sir, we would like to have your views on what is the future potential of integrating AI with traditional diagnostics methods.
I think this is actually happening at the moment and probably one of the most important things. Because at the moment when most people think about AI, it is they're looking at replacing doctors and radiologists. Well, that's not going to happen because there's an extremely high intellectual input that is required when you're making diagnosis, and especially when you look at diseases which are like a couple of thousand diseases. So I think those days are still to come. But what's at present and in the immediate future is that AI is creating such a support for diagnostics, because as you see technology moves, so your diagnostic machines are moving from 2 slices to 1,000 slices. So you're looking at a machine which is a couple of hundred slices, is giving you data and slices which are so many, it is impossible for somebody to be able to view each slice. So there has to be AI or software tools which will help the radiologists combine all this data so that they are able to view it very seamlessly, quickly, and without mentally taxing them, so that once they've seen it, they can spend their mental capacity and intellectual capacity to actually make the diagnosis and fine-tune the diagnosis. Additionally, whenever there is a scan done, there are a lot of measurements required, there are a lot of different densities, things to be given, and if that can all be automated by AI rather than the radiologist wasting their time doing that and their energy doing that, that's where it makes a difference. And the last point is that today a very important point about diagnostic imaging is that it is actually a communication tool to the referring doctor, so that he actually sees what the problem is in 3D, in actual images, so he can also explain to the patient what the problem, plus to the surgeon, very important, where the problem, what it is, relationship to neighboring structures. So 3D imaging tools which create 3D maps and 3D models from the data are extremely useful, so that the radiologists don't have to spend time doing that. So in a nutshell, I think this is the main impact that AI, or I call it software, is doing and aiding traditional diagnostics and taking traditional diagnostics to the next level. Thank you very much.
Thank you so much, sir.